lens is just not dense enough and the vacuum kind of
When you are doing your squeeze,
into the center of that half of that nuclear piece, booms.
from the 7th annual winter meeting of the IIRSI in beautiful Amritsar, I'm Josh Young. I'm here with my dear, sweet friend, Deepinder Dhaliwal. Deep, you were talking about squeeze chop. I don't even know what that is. Tell me what it is.
So have you ever done a case, Josh, where you're doing your phaco, you're trying to really just get vacuum on the fragment of the nucleus, but the lens is just not dense enough and the vacuum kind of eats through the piece?
And you're losing purchase. It's the most frustrating thing.
Exactly. So that's frustrating, right? But as an expert surgeon, you know how to get out of that, difficulty. How about if you could do chopping techniques without vacuum?
You can't do that.
But alas, you can. So what you can do is this really innovative. Not really, but it's so simple. It's the squeeze, chop, and flip technique that really we just kind of came across by how the idea of what's the safest way to teach chopping techniques to early cataract surgeons. I'm a professor of ophthalmology and I've been doing this for decades. So I have seen many, many, many surgeons kind of, get through their cases. And I realized the vacuum was a problem because, when you have high vacuum, it kind of eats the piece. They don't know what's going on. And then your other hand, it's kind of too confusing. So what we do is in squeeze, chop, and flip is instead of impaling the nucleus, we simply abut the nucleus with the sharp end of the phaco tip. So you abut that, and then you use your second hand to go under the capsule, around the lens nucleus, and basically you do an equal and opposite squeeze of that nuclear piece, and it chops. And then you just flip it out with your second instrument and eat it up in the safety zone.
So let me understand this. So first of all, that's very clever coming from you. That's not a surprise. When I am positioning my chopper before I actually execute the chop, is it blind? Am I going in blindly?
It's like horizontal chop,
Mm-hmm.
right? It's exactly like that. So basically, you just place your chopper like you're doing a horizontal chop, except you, instead of having active vacuum holding the piece, you are simply using equal and opposite forces with a sharp part of the phaco tip, and you're just kind of bringing the two instruments together, and then that is what will propagate the crack. And the nice thing about that is that you could do this for any density lens except for the super 4+ NS, where you would do a vertical chop anyway. So any type of horizontal chop, but the really soft ones, this works. The moderate one, this works. And you're not stressing the zonular apparatus because you're not moving your second instrument towards you. You're actually just meeting the phaco tip as that's coming together. Does that make sense?
Yeah, and this is really, really, really interesting. I know back in the day, many years back, there were some people, my former chairman, who advocated using two choppers to execute something similar. And I never adopted it because you have to do that and then you have to change one of the choppers out and then get the phaco. I've never heard of anyone before now using the phaco in the position of the proximal chopper. That's so clever.
All you do is make a deep central groove, crack the nucleus in half, then just turn the nucleus about 45 degrees so you have an optimal position. You take your second instrument, just like you're going to do a horizontal chop. Use any instrument that you like.
Yeah, what do you use?
I use the Drysdale. blunt, anything blunt, right? So it doesn't even have to be I don't even use a chopper.
Yeah.
I just use my Drysdale because I don't like switching instruments so many times. So I just use one instrument. But you have to go around the pole of the nucleus and then literally you bring your, second instrument and the phaco tip into the center of that half of that nuclear piece. Boom, squeeze that nucleus together between the two instruments. Voila.
Yeah, really, really interesting. I mean, one of the not in this context, but one of the things that I try to convey to residents, at least at the end of their training, is to take 5% of their attention on the centration of the crystalline lens while they're working to make sure that it's not moving, and I think to give feedback about keeping things like that. So I don't know how this would work with soft lenses, but when I have done things like this, I instruct the resident, because most of the surgery that I do now is resident teaching, is to actually orient the chopper sideways in order to get it to slide out better underneath the anterior capsule, and then rotate it, hook the lens, and then make the two meet.
Yeah,
it's obvious to you.
Sure. I mean, anything that works, right? Like getting that second instrument safely under the capsule, and and turning it to the side is a great idea. Some advocate just going straight and then going around the lens. It just depends on how dense the lens is. We know what technique works. So I kind of do what you do. I kind of go around the side, and then the key is going around the pole. And the beginning surgeons, what I say is go around the pole and then just a little bit extra.
Yeah.
And I think I ask them to think about coming up and in to meet the phaco tip. So you're kind of, like up and in.
This is the same way what I do. This is going to be a little multimedia thing here. What I do, this is my multimedia, is so innovative, right?
So fancy.
Not as innovative as this
Squeeze
technique.
chopper.
Yes. Is I tell them that the chopper shouldn't be oriented like this. It should hook the lens. I think that's basically what you're saying, to go the little.
Hook it.
So they've done this, and they've made their first chop. Do you? Because I can imagine that there are two ways of doing this. One way would be to chop everything. Another way would be to cut off that pizza slice, take it, go to the next slice. Is that what you do?
Well, almost. So what I do is I go ahead and I squeeze, chop the half, then I flip that quadrant out, I eat it up, but I do not eat that remaining quadrant, even though it looks so easy to remove. Don't remove it. Why? Because you're going to turn and chop the other half and remove one piece of that, while the initial quadrant that was left behind is going to stabilize the capsule. So that you have stability of the capsule as you're turning it. So you remove the first quadrant, turn the lens, and you squeeze chop the second half, flip that out, eat that piece, and now you have two quadrants left. And now you're going to take one and then take the other, but leaving that, that second quadrant intact there really helps stabilize the capsule. And I also, just to go a little earlier in the case, I really love to do a beautiful cortical cleaving hydrodissection and a delineation, because I believe the epinucleus is there for a reason. It's actually nature's capsule guard. It's the best thing we have to protect the posterior capsule from rupture. So leave it there until you're done with the case, so that you have protection. And the nucleus ends up being smaller in bite-sized pieces, if you will. So, everything's very manageable. And then the final step would be to remove the epinucleus. And you might think, you have to do another step. But no, if you do true cortical cleaving hydrodissection, the cortex comes out with the epinucleus. So then you're removing the nucleus, and then you remove the epinucleus. And if you've done it right, then the cortex comes out with the epinucleus. So you're not spending that much time in the eye.
I just want to make sure that I'm visualizing this properly. When you are doing your squeeze, that's a squeeze only of the nucleus. So you're not like trying to wrap around epinucleus. It wouldn't matter anyway. You just cheese wire through it. Yeah, Deep, this is brilliant, and I'm not blowing smoke here. No, because the sign of brilliance, radiance here. It's not coming up with something that involves some technique that's new. It's looking at what's in your quiver and using it in a different way, using it with a vision. I'm good. This is if yeah, I always say, I'm going to say again, if you learn one thing at a meeting, the meeting's worthwhile. And this is the thing that I've learned. I'm going to start doing this with my residents this week.
Squeeze, chop, and flip. And honestly, it's super simple. Try it at home. It basically works every time. And, it's very, very reproducible, which is great. So, Josh.
All that I can say, Deep, is thank you. First of all, thank you for thinking about this. Thank you for explaining it. You guys, you don't understand how difficult it is to verbalize a surgical technique. And this doctor has done it. I can visualize everything that she said. Most of all, Deep, I want to thank you for the generosity of your time with me today.
Josh, once again, you are such an amazing host, moderator, discussant, right? You just make it so easy to explain
I like
things.
the moon. All that I do is reflect your brilliance.
Oy, oy, oy. These lines, Josh, you must have been practicing in your hotel room. They're great. But no, really, seriously, thank you, audience, for your attention. And
we can't wait to see all of you next year.
Exactly. Amritsar Winter IIRSI conference is brilliant. And I think it's really, really a special kind of look and feel of the whole program. Thank you so much.